Hello, today we'll look at the classification of COPD. COPD is a chronic obstructive pulmonary disease. And why do we need to classify them? It's because we need to group the patients into different groups, and based on that we can do a treatment plan. Because we cannot treat all the patients the same. We need to treat all patients differently depending on their different conditions. And therefore we need some classification system. Which classification systems are the most important? This is something related to GOLD. This means Global Initiative of Obstructive Lung Disease. GOLD is a science group that have made two classifications which are the most important here. Something related to the FEV1. This means forced expiratory volume in 1 second. This means that the patient will inhale as much as he can, and then he will exhale as fast as he can, and we will measure the volume of air that is exhaled in 1 second. That is one classification, and this is used for diagnosis. The other one that we will use is something called ABCD. And this is used for the treatment, so therapy. So as you see, there are two classifications made by GOLD. The FEV1, forced expiratory volume 1 second, this will diagnose patients, and we use a spirometry device. This is a device that we can put in the patient's mouth, and then we can measure the volume. And the other one is ABCD, which is dictating which therapy we will use. So which one of these do we use first? Of course, FEV1. So we start with FEV1. And when do we use it? First, we need to do a spirometry. So the thing that we use, we always do a spirometry by patients that we suspect having COPD, spirometry. And then if you see that a ratio of FEV1 divided by forced vital capacity is less than 0.7, this is the value to remember, less than 0.7, then we go on with FEV1. What does this all mean? We see that we have an obstruction in the lung by using the spirometry, and we see that by this value, that's this ratio of FEV1 divided by forced vital capacity is less than 0.7. Then we know that we can take this FEV1 value from the population. There exist tables that you can download, and in this table we will have some values of normal people. For example, if we have a value of 2 in the normal population of a guy who's, I don't know, 65 years old and 160 centimeter high, I just took a number now, and we get, this is a table which is standardized in the population, and we get the value here that is only 1 from the real patient, so he's exhaling only 1, and the population exhaled 2. That means he is actually 50% of the population. Therefore, this value is then 50%. And as we know, GOLD classification of FEV1 can be based on 4 types. So we have 1, 2, 3, 4 based on the percentages here. So 1, 2, 3, 4. And if we have more than 80, so we have more than 80%. So we'll do it in this way instead. We will write 3 numbers, 80, 50, and 30. If we have more than 80%, then it's 1. If it's between 50 and 80, then it's 2. If it's between 30 and 50, then it's 3. And if it's less than 30, then it's 4. So this means that we have GOLD 1, 2, 3, 4 based on the percentages. These are percentages of FEV1 compared to the population. So we took this table and we saw that this patient only got, for example, 50% compared to the population. Then we know it's either 2 or 3. If it's less than 50%, then it's GOLD 3. If it's more than 50%, then it's GOLD 2. That was the diagnosis. As we said, this is used for diagnosis. ABCD is used for the therapy. So based on FEV1, we cannot do a treatment plan. We need to do a second classification, and this is the ABCD. And this is what I will talk about today, actually. So let's look at ABCD. Why is it called ABCD? Because we can group patients into 4 groups, ABCD. A, B, C, and D. We'll group A, B patients and group C and D patients. Based on what? Exacerbations. Exacerbations and hospitalization. Hospitalization. What does this mean? This means that either the patient was in the hospital due to this COPD, or he had exacerbation, which means just that he had an acute symptom of COPD, which was really severe. He cannot breathe anymore almost, and he need to go to hospital. So these two are kind of the same thing, because when you have exacerbation, then you come to the hospital usually, because we need to treat that in the hospital usually. But anyway, if we look at it this way, A and B are patients who had 0 or 1 exacerbations in his lifetime, or he had no hospitalization. He was not in the hospital. That is A and B. C and D are those that had more than 2, equal to 2 or more than 2 exacerbations, or more than 1 hospitalization. That's it. So now we have grouped the patients at least to this one. That means what I will do is I will ask the patient, when were you last time in the hospital due to this COPD? He says, yeah, last week. And why? Because I had an exacerbation. He will not maybe tell that he had an exacerbation, but he will tell that he had severe difficulty breathing while home, and then he had to go to the hospital. That means he's not in this part, because he was in the hospital. So we need to group him into group C or D. Now I need to differentiate between C or D. And how do I do that? It exists something called so Modified Medical Research Council Dyspnea Scale. Dyspnea Scale. Dyspnea means difficulty breathing. So Modified Medical Research Council Dyspnea Scale. And what will this tell us? This will then group patients into 4 grades. Let's take it here. We have 0, 1, 2, 3, 4. So actually it will group into 5 possible ways, and that will indicate the breathlessness of the patient. At what activity level does the patient complain of breathlessness? At severe strenuous, we will like strenuous activity, physical activity. Strenuous means he can do exercises normally. That's 0. Then he's actually 0. That means here in A and B, in A and C, we will put patients that are in group 0 to 1. 0 to 1. It means either these two. In B, we will put any patient who is more than 2. So equal to or more than 2. This part. This means the 0 and 1 is A and C. And this is B and D. B and D. And why is it like that? A and B are having 0 to 1 exacerbations or 0 hospitalization. As you see, this is the most important thing. As you progress here, it becomes more and more severe and more risky. This is low risk and this is high risk of COPD, which means we have more aggressive treatment here and less aggressive treatment here. And this symptoms is also indicating a more severe. So this is by strenuous activity 0, 1. This, the 4th one, is only by, for example, changing clothes. So dressing, I will just write dressing. So this patient cannot not even dress up without having difficulty breathing. This patient can do exercise, he can really run and do anything he wants. This guy, he can walk uphill. This guy, until he gets difficult breathing, this guy, he can walk not uphill, but in a transversal, so in a normal way, going on the street, and he will walk, but he will do it slowly. This guy, he can also walk, but only for a couple of minutes. Minutes. So, to remember this now, we have 5 types of guys here. We start with the worst case. This guy wakes up, he's dressing up, and he starts to breathe slow, really difficult. It's really difficult to dress up. Yeah, he's totally exhausted. He calls up his friend, asks him, how are you doing? Yeah, I'm taking a walk. I've walked around 2 minutes and I'm totally exhausted. He is also exhausted. He calls up his other friend. He says, what about you guys? What are you doing? I'm walking regularly. I was shopping here and there. It was no problem. But okay, I walked slowly. Calls up the 4th guy. He says, oh guys, you're so useless guys. I mean, what are you doing, man? I'm going uphill. I'm going in the mountains. I'm looking for some beautiful view here. What are you doing in the city? Please come here to the mountains. And then this strenuous guy, this last guy, he's saying, oh, you are all a bunch of useless guys. You have been smoking too much. I'm bicycling. I'm running in the mountains. I'm swimming. I'm doing everything. Okay? But he also has COPD. But he has COPD, which has been shown in the spirometry, but he doesn't feel it. He's the best case. He doesn't feel it. That's the best case. And he's group A or B. And now I need to decide whether this guy is A or B. We know it's A or B, but we need to decide whether he's A or B. And that is based on the dyspnea scale and based on exacerbations. And we will see that this strenuous guy, he has then 0, which means he is A. This 4th guy, he cannot dress up. He is having then more than 2, which is B. But of course there exists a strenuous guy here also at C, but he had more than 2 exacerbations, or he was in the hospital more than once, and therefore he's not A, but he's C. He's worse. So the most important question to ask: was you in the hospital? Did you have an exacerbation? He says no. C or D. Then I ask, what can you do usually normal? What can you do before you get difficult breathing? He says, no, I can do anything. I can walk around and everything. Okay, you're a C guy. Based on that, I will give you a treatment. Treatment will be dealt in another video, but now we know that this is a C guy. Like we take another example. I ask him, when was you in the hospital last time due to this COPD or due to exacerbations? He says, yeah, I was never here because of COPD. I was always treated by the family doctor or the doctor who is specializing in pulmonology, but I was not really in the hospital due to severe exacerbations. Then I know A or B guy. Then I ask him, what can you do normally? No, I actually have difficulty breathing by dressing up. Then I know it's not an A guy, it's a B guy. Or if he tells me I can walk slowly and then after a while I get difficult breathing, then I know it's a B guy. Everything which is above 2 here. So it doesn't matter if he walks slowly, he can only walk a couple of minutes, or he can only dress up. This is all B guy or D guy. If he can do strenuous activity or walking uphill, he's an A guy or a C guy. And depending on the exacerbations, I know it's A or C or B or D. You get that? So, to remember the classifications, we have gold classification, which is based on FEV1. That means I can classify the patients into 4 groups based on the percentage of FEV1 value. We have, remember, 3 values, 80, 50, 30. Everything above 80 is 1, 80, 50, 2, 50, 30, 3, and then less than 30, grade 4. So grade 4 is the worst. He has 30% of what the normal population has. Why is this classification important? Because of diagnosis, nothing else, not for the treatment. Now we know that we have diagnosed the patient. Now we go on with the gold ABCD classification. Why? Because we want to give a treatment to this patient. And we can only give treatment to patients we have classified with ABCD. Then I do the ABCD. I group A and B, I group C and D. A and B will get are those that have 0 exacerbations or 1 exacerbation or 0 hospitalization. C and D, those that had more than 2 exacerbations or was in the hospital more than once. Then I group the patients into the other classification system, which is called MMRC, which is Modified Medical Research Council, dyspnea scale. And based on that, I can differentiate between these, A or B or C or D, based on if they were more than 2 points or less than 2 points. That's it. So I think that is enough, and then we will do the treatment part. And please do flashcards. Please write question answers, practice it at home, and then you will master this. Or please check this video 3 times, 4 times, 10 times, whatever necessary, and then you will see that you will remember this, and you can then expect to know this, and then with the video of the treatment video, then you can treat the patient accordingly, and then you are really up to date, you are evidence-based, and you're doing the correct treatment for the correct patient, because you cannot treat an A patient as you treat a D patient. That's my main message. Thank you very much for listening.